Hi everyone, I'm Dr. Evelyn with Pasadena Animal Hospital, and today we're going to talk about pain management. First, let's talk about why your pet might be in pain. Either they suffered an injury, created a wound, maybe they had a procedure that led to postoperative pain, or maybe they're an older pet that's suffering from arthritis, a condition that can be painful later in life. Noticing pain in a pet can be tricky, especially if you don't know what to look for. Some signs of pain that you might see at home would include limping, holding their leg up, potentially not wanting to move as quickly as possible, panting all of a sudden or panting excessively. They could also not want to eat if it's pain in the mouth. They might be sensitive to you touching the area. Some pets might even start to become more aggressive when you're handling them because they're painful and you might not know where they're in pain. Because some signs of pain can be even more subtle or might be confusing to pet owners, it is important to have your veterinarian examine your pet if there's any potential change in behavior, any of these symptoms I described, so that they can look for signs of pain that you might not be able to tell otherwise. A physical exam will allow us to identify if there is pain or not based on the pet's reaction to their palpation to their joints, to different parts of their body, and looking for any wounds that might potentially be a source of pain. This is also why it's important for you to have your pet examined annually by your veterinarian, because a lot of these things we can find on a basic physical exam, even when you don't see symptoms at home or when you might not find or feel something unusual at home. Some physical signs of pain that your veterinarian might find on physical exam would include your pet pulling away or shying away, maybe even trying to bite when your veterinarian is examining a specific area. Your vet coming across a wound or something that you didn't know was there present, maybe an inflamed ear or a bad tooth. Those are all things that we would be looking for as a veterinarian examining your pet so that we can identify sources of pain. The physical exam that your veterinarian performs can tell us a lot about where they might be in pain or what might be causing the pain. However, sometimes it's not very clear, in which case diagnostics may be recommended. Sometimes if we are unsure if there's a wound somewhere, we might want to shave the area and get a better look, or do a procedure to identify the source of pain. If there is potential for a broken bone or something, your veterinarian may recommend to perform an x-ray. So a lot of times we can get a lot of information from the physical exam, but diagnostics are equally as important to help guide us in how we will treat the pain. Once your veterinarian has identified the source of pain or discomfort, we want to go ahead and treat that. The treatment will vary depending on the cause. Let's say there's a wound, then we might want to do some kind of procedure on it, or possibly put your pet on some medications like antibiotics, pain medications, so that we can resolve the actual condition and your pet can be more comfortable. Another example of treatment being dictated by the cause would be if your veterinarian suspects arthritis. That's typically going to be a type of treatment that would be more ongoing and long-term, and usually they'll talk to you about types of medications and different options we have for treatment for that particular condition. Treatment for pain after surgery would include medications to go home after the procedure, possibly some laser therapy to reduce inflammation, and potentially having you rest your pet and having your pet not be too active to reduce the chances that pain is going to flare up. Now let's talk about treatment options in a little bit more detail. There's two types of ways that we're going to manage pain. There's acute pain management, which involves managing pain for conditions that are sudden or short-term. Let's say for after a procedure, or again if there's a wound that we're going to heal. Then there's also chronic pain management. That's managing pain for conditions that are long-term. Let's say your pet has arthritis. Let's say your pet has a long-standing injury that's going to lead to long-term pain. There are different modalities for pain management that we can use for multiple causes. Here at Pasadena, we believe in multimodal pain management, which means we can use multiple modalities to try to reduce pain or relieve pain in different ways and make our patients as comfortable as possible. Different modalities that we use for pain management include medications, whether it's strict pain control medications that stop the pet from feeling pain, or anti-inflammatories that can reduce inflammation and as a result relieve pain. Additionally, we like to use alternative methods of pain management, which include cold laser therapy and acupuncture. Sometimes with orthopedic types of issues, we might recommend physical therapy for a patient to help strengthen their joints and muscles. Remember, pets don't usually show signs of pain the way that we do, and it's very unusual that they'll vocalize. It typically means they're in excruciating pain when they do so. If you do suspect that your pet is in pain, make sure you consult with your veterinarian so they can come up with a treatment plan and make sure your pet's as comfortable as possible.